Nihaila here. I'm the founder of the brand IamonDialysis, where we help you, kidney patient, and your loved ones to overcome fear, sadness, and loneliness in order for you to achieve your goals and dreams. Today's topic, symptoms. The symptoms that will accompany kidney malfunction. And today I have a little help of a doctor. I don't know her personally. I saw her video online on YouTube, and she was describing the symptoms perfectly. So I'm going to share that with you. I'm not going to go through every single symptom that she mentioned, just a few that I think it's very important to notice. But I will leave the link down below in the description in order for you to go to her site and see the video incomplete for yourself. Now I'm going to let her introduce herself, and then we will continue on to the symptoms. Here she comes.
I'm Dr. Freda. I'm a triple board certified medical doctor, and I practice nephrology at Emory University Hospital Midtown. I'm also the medical director of a dialysis unit with DCI here in Atlanta. As a nephrologist, I diagnose and treat kidney failure, and I often find that many of my patients whom I diagnose had no idea of the kidney failure symptoms. Many of them were also unaware that they were even at risk for kidney failure. The top two causes of kidney failure in this country are number 1, diabetes, and number 2, high blood pressure. Patients with lupus are also at high risk for kidney failure.
Wow, isn't that very interesting? That the top 3 illnesses, or at least the top 2, are blood pressure and diabetes in America. And I just went and searched for Holland, and those 2 are also very, very high. 10 to 20% of the causes for kidney failure is unknown in Holland. So that gives a lot of room to speculate for what is the actual cause of kidney failure. But let us continue, because she has like 10 symptoms, like I already said, and maybe one extra. And also, like I mentioned, I'm not going to go through all the 10. I'm just going to highlight a few and give some experience from myself as a person on dialysis, how I experience those symptoms. Okay, let's continue.
Today, I'm going to discuss 10 symptoms of kidney failure. Question: how many of you have been diagnosed with kidney disease and you were shocked because you did not know the symptoms and you did not know the risk factors? Please comment down below. Number 1, fatigue. A symptom of kidney failure can be fatigue or being excessively tired even when you've had good sleep. There are many reasons that you could be fatigued. Anemia is one of them, or a low blood count. And you can also be fatigued if you have a shortness of breath, especially if you have fluid overload in your lungs related to kidney failure.
One of the first symptoms that she is mentioning is fatigue. Now, in my case, I really experienced a lot of fatigue. I still experience a lot of fatigue. And when she mentioned fatigue, it's not just, when you have a rough day, been active the whole day and go to bed very tired that you sleep immediately. She already mentioned excess fatigue, meaning you go to bed tired, but you wake up tired. Like even if you sleep like 24 hours with nonstop, and wake up, you still feel tired. That's what it means, feeling tired when your kidneys are malfunctioning. So it's not just in a healthy person kind of way that you've been very active the entire day, like you walked or ran a marathon or such, and then at the end of the day, you're really tired. Not that kind of tired. It's even worse. So, because if you're healthy, run a marathon, you might feel a little tired the next day, but you're just up and running and do your thing. Not in this case. You're just tired. You slept like 10 hours, wake up, you're still tired. You can sleep. You can do like half an hour or something just to be busy, and then go back to bed and sleep just as well. So that's what is meant to be tired as a person that has kidney malfunction.
Skin. Number 4, urinating frequently. If you are a person who is urinating more and more frequently, especially if you're getting up in the middle of the night to use the restroom, This could be a symptom of kidney failure. There are many reasons. One, as the kidneys start to get worse, you don't concentrate your urine as well, and so you may urinate more frequently. And there are other reasons that you could have urinary frequency outside of kidney disease alone, such as diabetes or an enlarged prostate. Or if you have a urinary tract infection, you may get a certain urgency and feel like you have to urinate frequently. At any rate, if you are urinating frequently, check with your physician because this could be a symptom of kidney failure.
Yes, as you noticed, I already skipped a few symptoms there, so you better go and watch the other symptoms in her own video. But this one I want to highlight, the excessive urinating. I'm not talking about when you go on a detox and you have to go pee a little more extra. Like, let's say usually you go like 5 times a day, and now you're finding yourself going 8 times a day due to excess drinking or whatever. I'm talking about at least 10 to 15 times more, 10 to 15 times compared to your regular 5 times. And this is something that builds up, especially when you are chronic illness, that it builds up slowly but steady, that you find yourself in a moment like, hey, but I'm starting to urinate a lot. So it's not that from today to tomorrow, you're like starting to urinate for like 5 times to let's say 10 times a day. That might be once in a while because you had the day before, you had a great party, drank a lot and started urinating a lot. Or you started a detox that takes out the excess fluid that you have in your body stored. That takes that away, that you are urinating a lot. But this is just, even though you are drinking normally and such, you're going to urinate a lot. Sometimes just a little bit, sometimes a little bit more. But you started to noticing, hey, I'm going a lot of time to the bathroom. So that is, like she would say, a reason to go and check. Let the doctor check it for you to see what's going on. Let us continue with the other symptoms.
Number 5, bubbly or foamy urine. If you urinate in the toilet and it looks very bubbly or foamy, as if you've just poured a beer or something, then this could also be a symptom of kidney failure. When patients have protein in the urine, if they're leaking protein in the urine, this could give that bubbly appearance of the urine in the toilet. Protein leakage is not normal, and it is a sign of kidney failure. So pay attention to your urine. If it's looking foamy, this could be a symptom of kidney failure. Number 6, leg or ankle swelling. Patients with kidney failure can get swelling in the ankles and the legs for different reasons. It could be an issue with the way they're filtering their sodium. Also, if they have kidney failure, then they can be retaining more fluid. Now, there are other things that can cause swelling of the ankles and legs as well.
Yes, another symptom that we need to discuss, the swelling of the leg and ankles. Now, I want to add one more to that, because when your ankles and your legs start to swell because of fluid retention, what you also can get is gout. For Dutch people, jicht. When you get gout, your toe, especially the big toe, will start to feel very, very warm, and it hurts. It hurts like you can feel it in. What's the case? That because your kidneys are not functioning well, and therefore not getting all the fluid out, not getting enough urine out, that urine that stays in your body will start to become a crystal. And that crystal is extremely pointy. And what it does, it goes to the lowest part of your body, and that is your big toe. And it just accumulates in there. And it starts to hurt, it starts to swallow, it starts to feel very, very warm. And that can come as accompany with your legs being swollen and also your ankles, because the fluids is there. But that is also a symptom that can be for malfunction, kidney malfunction. So be very attentive of your body and see if you have these symptoms. Now, let us continue with some other symptoms so we can wrap it up as soon as possible. Well, not as soon as possible, but you know what I mean.
Number 7, loss of appetite or decreased appetite. In the later stages of kidney failure, you could lose your appetite. Due to the elevated toxins that are not being filtered out by the kidneys, it can cause food to have a bad taste in your mouth, or you just don't want to eat anything and you start to have weight loss. So if you have an unintentional weight loss or a loss of an appetite, this could be a symptom of kidney.
Another very, very important symptoms, loss of appetite. Now, in my case, I experienced not much as in loss of appetite, but more of the part that even though I'm feeling hungry and I want to eat, I cannot eat. And she already mentioned it, like the elevated toxins in your body. The fact is that because your kidneys are not filtering the way they should, getting all the toxins that you have in your body, getting them out. Now, the toxin stays in, so it builds up, and your body is sending a signal to your brain saying, "Hey, I don't have any more space for nutrient or minerals or vitamins, whatever." So when you eat something, you might have a plate full because you're hungry, you want to eat that, but then what happens, because your body is full with toxins, you might only eat like 2-3 spoons of that delicious food and you're full. You cannot eat anymore. And even if you force yourself, you might find yourself vomiting all the food that you are eating. And that's also a waste. So you just eat the 2-3 spoons that you can eat. And then probably, unfortunately, that might be the only 3 spoons you may eat that day, because your kidneys are that malfunction. You are so full of toxins, you are literally poisoning yourself little by little, day by day, because you're not getting the toxins out of your system. So this is also a very, very important symptom of kidney malfunction. Let's continue to, I think, one more, a very, very important one. I think the most important one, and we will talk after that, and then we will start to discuss even more. See you later.
Oh, and there's one important symptom of kidney failure: no symptom. Early on in kidney disease, you may have no symptoms at all. That is why it is so important that you see your primary care physician, ask to be screened for kidney disease, and find out what your risk factors are. You want to stay healthy.
Okay, that one was the most important one, because when you get the diagnosis of you have kidney malfunction, you will be surprised, because usually when kidney malfunction is detected is when you have less than 30%, less than 30% function. Then you start to see all the symptoms that we discussed today. But prior to that, you will have no symptoms, none at all. You will live your life as if nothing is going on. And what will happen is that you will continue your bad habits at contributing to your illness. All the things like eating very salty, eating a lot of meat, eating very wrong, not sleeping enough. All those things that contribute to kidney malfunction, you will continue to do that until you have like less than 30%. There are ways that you can bounce back from that 30% without you even needing dialysis, but we will discuss that another time. But for now, I want to just talk about this, because in my case, and I will use myself an example all the time. In my case, what was the issue? I was starting having symptoms since I was 12. But I did not know, of course, as a child, and my parents also did not know because they are not doctors, that all the symptoms that I was getting were related to kidney malfunction. It took at least 3 to 4 years before the doctor even discovered it, because after those amount of years, I was fed up feeling the way I was feeling. The tiredness, the fact that my condition was going backwards, all the little infection, little fevers, all those things were coming up and up and up and up and getting more urination. I was waking up like about 5 times a night, sometimes 6, 7 times a night, just to go to the bathroom to urinate. So I was tired. All those symptoms accumulating to me, eventually discovering that I had kidney malfunction. Now, I don't want you to wait till the last minute, because when they discovered I had less than 10% of kidney function left, we boosted up with prednisone to 30 until I really needed to go on dialysis. But I don't want you to go that far. We want to detect it way earlier, so you still have a chance to reverse it. Now, that being said, please take care of yourself. If you feel that any of these symptoms are applicable for you, go to the doctor and let yourself get checked. If you need some other help than what the doctor is prescribing, please contact me. I will help you and get you in the right direction for you to go get real help. What else is there to say? Stay healthy. Don't overdo on salt. Don't overdo on meat. Start exercising. Get that weight down, because we already mentioned in the beginning, the main cause of kidney malfunction is high blood pressure and diabetes. So if you are a person with with a lot of overweight, start reducing it in order for you to maintain your kidney function and in your health, actually. So do the things that is necessary for you to get in a better health, for you not to lose your kidney function. Okay, that is it for today. Like I said in the beginning, I will leave the link to the video, the complete video of Dr. Frieder's message of the 10 symptoms, and for you to go through them for yourself and see if all these symptoms apply to you or not. I hope not. That means you're still healthy and still good, and that we can continue tomorrow again with our lives. Take care of yourself, love yourself. See you next time. Bye.